right, welcome to the emergency room. The patient today is Blake Beck.
Do that now.
Dr. Lucich has been really influential in helping transition into medical school as a first-year medical student. He's the one that helps us in our first Introduction to Clinical Medicine course, where we're learning all about how to take a history and a physical, and that's something that feels really, really daunting. But it's something that Dr. Lucich helped us to break down into small pieces. And by the end of the semester, when we had our final and did the full history and physical, it was something that I felt confident in being able to do, because I feel like he gave me the tools along the way to make sure that I was able to do that.
Lucich always has a sense of humor and wit. It makes a week long of endless meetings much more enjoyable. And students love the humor in his lectures, and it makes them much more memorable.
But my main goal with regard to teaching medical students is to basically make it interesting for myself. Somebody actually said that to teach is to learn twice, and I'm very much a learner. I mean, I'm sort of programmed to do two things: learn and laugh. And so if I can combine learning and some sort of identify the humor in things, I think that's a really effective way to do things, and it keeps me interested too. So the fact that people enjoy it, that's just sort of extra.
You're going down an assembly line. So let's say that this first row is a tubule, and here comes the fluid out of the glomerulus. Boom, I'm coming around, I got some sugar, I got some sodium. You pick back the sodium. Boom. You pick back the sugar because you like sugar. You find out that there's too much fluid, so you probably let the water pass, something like that.
Well, I think Dr. Lucich has abilities in so many different ways in educating and mentoring students. He brings both humor and clinical insight into topics. The other is in leading skills, small groups, and simulations. And these are really the types of interactions that we really want our medical students to excel in. Not just the classroom, but their interactions with future patients.
I was wondering, can I borrow your Shakeology? All right, I just want to make sure we have this clear. This Shakeology device is my heart, okay? And the axis of the heart is I'm trying to, when I'm determining the axis of the heart, one of the things I'm determining is which direction the heart is rotated in the chest this way. So I'm using the limb leads to detect rotation of the heart.
I know where you're wanting to go, and if I treat you the way that, and communicate with you in a way that made sense for me as a medical student, I think that's very helpful. This is something I would probably be inclined to do for free, just between you and me.